those two are pretty easy. They're the two bumps on the side of the ankle. Just use the bone proximal and travel down. So if I'm on the lateral malleolus, it's the fibula, right? So I'm palpating the fibula, travel distally. And then when I come to the very end part of the fibula, that's the lateral malleolus. And the same thing with the tibia. I'm on the tibia, which isn't here, because this is calf. So I'm kind of, I come around to where I feel the bone, and I travel down. The distal part of the tibia is medial malleolus. Okay, those two are pretty easy. Tubercle of the fifth metatarsal. Okay, your handout has you kind of starting at your IP joint or the first phalanx for the fifth metatarsal. I think you can go from the lateral malleolus, because basically it's just this tubercle right here at the base of the fifth met head. So if you start at the pinky toe, travel kind of posteriorly or towards the calcaneus, and when you get to that small bump at the end of that metatarsal, that's the tubercle of the fifth metatarsal. If I'm traveling from the lateral malleolus, I'm kind of going inferiorly, maybe a little bit kind of at an angle, make an imaginary line. I run past the ligament, which we'll palpate in a second, and then I get to the tubercle of the fifth metatarsal. Which muscle attaches to the tubercle of the fifth metatarsal? Which muscle? That's what he said. It's not the abductor digit minimi. Peroneus brevis. Peroneus brevis. So the longus comes right behind it and goes underneath the foot and attaches at the first cuneiform and the first metatarsal. But both of them do eversion, and we'll palpate those in a second. Dome of the talus. So in all of this, it says supine or long sitting is fine. You can also do sitting in a chair, but you have to get on the floor to show me kind of where you're at. So the talus is the bone right underneath the tibia. It's going to intersect the medial and lateral malleolus. Okay, so I'm going to bring his foot into dorsiflexion, and I'm going to try to do it passively. So I'll have you relax, because if he does it actively, go ahead and bring your foot up. What gets in my way? Tendons, right? So if I do it passively and those guys are relaxed, you see how my thumb kind of sinks in right there? Okay? And then as I plantar flex him, the talus goes into, or the trochlea of the talus goes into my thumb, and or index finger. So it disappears, and then that smooth surface is the talus. Subsentaculum tali. It's on the medial portion of the foot. So when you're looking over these, kind of group them into middle part of the foot and ankle, lateral part of the foot and ankle, and then maybe on top of the foot and ankle. There's nothing that we have to palpate on the bottom of the foot during the palpation exam. And it's pretty important. The reason why is because when you're palpating, you have these bony landmarks that stick out on the medial, on the lateral side, and it can get a little confusing. So like last class, we talked about the subsentaculum tali, which is on the medial portion of the ankle, and everybody was finding it on the lateral portion because we have bumps that are very similar to how it would feel on the medial side. So group them and make sure you're on the right side of the foot when you're palpating these structures. So subsentaculum tali, I'm starting kind of at the floor or at the table, right where the calcaneus is, where it's soft, kind of in his arch. So right there, I palpate, and my finger sinks into that soft tissue. I travel up vertically towards the medial malleolus, soft, 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 and then I get to a bump right there, and that first bump or that first hard structure is the subsentaculum tali. Okay, and you feel that right there, right? That's all soft, the first bump. So it's almost going to feel like a mini medial malleolus, right? We have a big one right here, and then you have a mini-me down below it. Okay.
Could you go from malleolus here?
Yes. The thing is when I'm going to malleolus, I feel a bump, and I have to make sure, okay, there's my second bump. Whereas when you're going from the top, it's just soft tissue, and then that first bump is it. But you can go either way in a vertical direction. Dr. Philo?
Yeah,
Tali?
As in talus?
root something. All right, go look it up.
So where'd you start from?
What was that?
Where'd you start?
I started, if I'm coming inferiorly, I'm starting right at the kind of base of the foot, just
okay.
the ground,
I didn't have
or the
any
table.
names.
Yeah, so if I'm on the calcaneus, I come straight down from the malleolus and just the soft tissue right next to the bottom of the foot. And then I'm going up towards the
Sitting after you just said just the bottom of the foot. I hope I
yeah, at the bottom of the foot, directly below the malleolus, and start traveling up towards it, and that first bone, first bump. And then don't, I mean, what,
You know what you said.
Yeah, somebody getting on their paycheck on the screen.
it's just Nolan. Thanks, man. Good call. So when you're looking at root words like this, don't get confused because talide sounds like talus, right? But it's not on the talus. It's on the calcaneus. Okay? So it's a bump on the calcaneus, not on the talus. Good. Little distractions going on. It's good. It spices it up a little
It
bit.
means plural form of talus. So maybe because they articulate? I don't know like the talus in
It's close to the talus, but it's on the calcaneus. So yeah, maybe it's because it's a bump.
Just wondering.
No, thanks.
Miranda.
All right, come the screens back down. All right, navicular tuberosity. This is also on the medial aspect of the foot. So we're drawing an imaginary line from the kind of MTP, or the first metatarsal, and the medial malleolus, right? And this is how it tells you to do in the manual, and I kind of like it too, because you see this line that goes right there, and then you divide it into thirds. And that first third, coming off the medial malleolus, you see that little bump right there, is the navicular, or navicular tuberosity. Much muscle attaches there?
Talus is Latin for ankle.
Talus is Latin for ankle.
Your abductor house.
It's probably the
It's going to be your posterior tibialis. All right? So when we palpate, so we're going over this bony landmark, so when we palpate the tendons, we can use the bony landmarks to get to the tendons and perform the action. So that first bump is the navicular. I keep traveling down to the second third of my imaginary line from the medial malleolus to that first MTP. And the second third is the first cuneiform. That's the next structure on your list. First bump, navicular. Smooth surface, but still hard structure, is cuneiform. Okay? So closer to the ankle, you're going to feel a little bitty bump, and that's tuberosity. The cuneiform is hard to palpate because there's not really a bump that sticks out. Just know that as you're coming off it to the second third, you'll find kind of a smooth surface right there. That's a cuneiform.
The sosentaculum, I've confused it with the navicular tuberosity. So where was it again?
Okay? Navicular tuberosity is going towards that first MTP, that line, that first third. So I'm traveling away from my ankle in an anterior direction. So there's the navicular. The sustentaculum tali